Hi everyone, in this video we are going to discuss about what is midbrain and what are all the structures involved in midbrain and what are all the functions of the midbrain. In this picture we can see the midbrain is visible here, which is the uppermost part of the brainstem. This is the whole brainstem, midbrain, pons and medulla oblongata, which is situated under the subcortical structures like the thalamus and in front of the cerebellum and under the cerebrum, subcortical and as well as cortical structures. So it was also called as the mesencephala. It connects the forebrain with the hindbrain. It has a cerebral aqueduct. The cerebral aqueduct is nothing but it was a part of the ventricular system. So I show it schematically. The midbrain and pons. The midbrain is present upper and pons is present lower. The cerebral aqueduct is present at the midbrain as a part of the ventricular system, which connects the third ventricle and fourth ventricle at the pons. So in the midbrain there are some important structures to remember. What are all? Crus cerebri and substantia nigra and tegmentum of the cerebral peduncle, which is wholly called as cerebral peduncle. The tectum, which is present posteriorly, it is divided into two parts. One is superior and inferior colliculus, the red nucleus of the brainstem. These are the important structures as well as the gray matters to remember in the midbrain. So what are all the cranial nerves to remember in the midbrain means? It was the third and fourth cranial nerve. Third one is the oculomotor nerve and fourth one is the trochlear nerve. The ventricular system which is related to the midbrain is cerebral aqueduct. In the lateral view of the midbrain, we can see the anterior and posterior parts. The whole body of the midbrain is present anteriorly, and behind it posteriorly there are two colliculus, superior and inferior colliculus. From the anterior, the crus cerebri is present more anteriorly. Next to it was the substantia nigra, and then the remaining whole is the tegmentum, where the cerebral aqueduct is present. So emergence of the oculomotor nerve. At the level of superior colliculus, the oculomotor nerve emerges out of the midbrain. So from the oculomotor and Edinger-Westphal nucleus, the oculomotor nerve emerges in front of the midbrain. So the oculomotor nerve emerges at this level, at the superior colliculus level, in front of the midbrain. So at the level of inferior colliculus, the fourth cranial nerve, trochlear nerve, emerges from the trochlear nucleus, but the pathway for the trochlear nucleus is different because it goes back and turn in front to rotate around the inferior colliculus. Coming to the components of the cerebral peduncle, the first structure to discuss is the crus cerebri. The crus cerebri has the following components. The white matter is filled in crus cerebri. It has some motor tracts. The motor tracts is further divided into three components. The first one is the frontopontine fibers. From the frontal lobe to the pons, the fibers make a pathway through the midbrain. It occupies the 1/6 of the component of the crus cerebri. Next one is the corticospinal tracts, which present in the middle, and again the temporopontine, paritopontine, occipitopontine fiber, which is present laterally, which also occupies the lateral 1/6 of the white matter of the crus cerebri. So next one, the substantia nigra, is the most important structure which deals in the secretion of the dopamine It is further divided into pars reticulata and pars compacta. The substantia nigra is the grey matter of the midbrain, which is considered as a part of the basal nuclei or basal ganglia. It is an important structure of the midbrain, but it is considered as a part of the basal ganglia. Why it is called as substantia nigra means, in the Latin it was called as the black substance. The black means nigra, the substance means substantia. So the substantia nigra in the Latin, which means black substance. So why it is called as a black substance means, why it appears black means, due to the presence of a neuromelanin in the dopaminergic neurons, it has a high neuromelanin component which gives the color black. It is further divided into, the substantia nigra is further divided into substantia nigra pars reticulata and substantia nigra pars compacta. Sometimes another part is considered to the pars reticulata. It was the pars lateralis. So the substantia nigra is divided into three. One is the substantia nigra pars reticulata, second one is the substantia nigra pars compacta, and the third one is the substantia nigra pars lateralis, which is sometimes considered as a part of pars reticulata. So substantia nigra, to know about its functions and its structure is very important. The pars compacta, which have the dopaminergic neuron, and the pars reticulata, which have the GABAergic neurons. The pars compacta, which contains the dopaminergic neuron, secretes a precursor of a dopamine called L-dopa. The pars reticulata is nothing but a gamma aminobutyric acid secretion, which is secreted by the pars reticulata. So both pars compacta, dopaminergic neuron, the GABAergic neurons of the pars reticulata, which projects into the subcortical structures called the basal ganglion and the thalamic projections. Coming to the important physiology of the substantia nigra, these three structures, the striatum, which contains caudate and putamen, it is also called as corpus striatum, which is the main structure of the basal ganglion, and the globus pallidus externus and globus pallidus internus, which is also considered an important part of the basal ganglion. It was the cortex, and this is the thalamus, and this is the subthalamic nucleus, and this one is the substantia nigra, the black substance. So this is the schematic representation to show how the substantia nigra functions. Coming to the connections between the substantia nigra and the cortical and subcortical structures like thalamus and basal ganglia, it is very much important to know about the connections. So from the pars compacta, two neurons, dopaminergic neurons D1 and D2, connected to the corpus striatum. From the D1 neuron, there is an inhibition to the globus pallidus internus, and there was an excitatory stimulus which given to the globus pallidus externus. It is proved that the D1 is always inhibiting the globus pallidus internus and D2 is always stimulating the globus pallidus externus. So before going to it, there is another connection between the subthalamic nucleus, which always stimulating the globus pallidus externus. There was another connection from the globus pallidus externus, which inhibit the subthalamic nuclear connection to the globus pallidus internus. So there is an inhibition of the globus pallidus internus. This is the direct pathway which inhibits always the globus pallidus internus. There was also an indirect pathway which stimulates the globus pallidus internus. When the substantia nigra pars reticulata inhibited, it stimulates indirectly the globus pallidus internus. So from the globus pallidus internus, inhibitory impulses will send to the thalamus, and the thalamus will send informations to the cortex. So I am giving the plus or minus symbol here. Why it is given here means the movements is to be corrected according to the tone. if we want a flexion to the 80 degree, it does not go beyond 80 degree, or it does not undershoot under the 80 degree. So it is necessary to achieve 80 degree. The thalamus will send the impulse to the cortex. By this mechanism, the plus or a minus, the positive or a negative impulses will go to the cortex to maintain the tone, to maintain the speed through this system. So it is very important structure, substantia nigra, which help to maintain the speed, which help to maintain the tone of the whole muscles. There are some structures to remember on the tegmentum, the red nucleus and the lemniscus. There are 4 lemniscus in the tegmentum. What are they? Medial lemniscus, lateral lemniscus, trigeminal lemniscus and spinal lemniscus. In the mnemonic words, we can call it as MTSL lemniscus. MTSL lemniscus. So what is the red nucleus? The red nucleus is an important structure. It is also called as the nucleus ruber. It is 0.5 centimeter in diameter. Due to the presence of the hemoglobin and ferritin, the iron component, it looks like red or pale in color, pink in color. It looks like a red or pale pink in color. It is present anteriorly at the tegmentum. So what are the function of the red nucleus? It also helps in the regulation of the muscle tone. So it has an inhibitory influence on the muscle tone. It receives the afferents from globus pallidus, subthalamic nuclei, cerebral cortex and superior cerebellar peduncle, and give the efferents to the spinal cord, reticular formation, thalamic nuclei, olivary nuclei, subthalamic nuclei. So here you have to note the globus pallidus and subthalamic nuclei giving the efferents to the red nucleus, which act as an afferent for the red nucleus. So the red nucleus again send the impulse to the reticular formation, thalamus, olivary nucleus and subthalamic nucleus to maintain the muscle tone regularly. Lemniscus, in Latin it means a ribbon. So the lemniscus is an important sensory component which carries the pathways of a many sensory tract to the thalamus. So the first lemniscus we are going to discuss here is the medial lemniscus. It is also called as a Rayleigh band or Rayleigh ribbon. So from the nucleus cuneatus and nucleus gracilis of the spinal cord, the informations are carried through the fasciculus cuneatus and fasciculus gracilis through the internal arcuate fibers. It is sent off to the thalamus through the brainstem as a structure called. So in this picture we can see the medial lemniscus, which arises from the nucleus cuneatus and nucleus gracilis. So it starts at the upper part of the medulla after the sensory decussation. After the sensory decussation, the medial lemniscus starts. So it acts as a pathway for the touch, vibration and proprioceptive sensation, which is the function of the nucleus cuneatus and nucleus gracilis. So it acts as a part of posterior column and medial lemniscus pathway. Next one is the trigeminal lemniscus or the trigeminothalamic tract. From the principal nucleus of the trigeminal system, the contralateral trigeminal nuclei, to the ventral posterior medial nucleus of the thalamus. Thalamus have several nucleus. The ventral posterior medial nuclei present medially and posteriorly at the thalamus. So from trigeminal nucleus to the thalamus, the pathway is called as trigeminal lemniscus. So the trigeminal lemniscus convey the tactile, pain, temperature impulses from the skin of the face, the mucous membrane of the nasal and oral cavities and the eye. So from the eyes, from the mucous membranes of the nasal and oral cavity and the skin of the face, it carries the tactile, pain and temperature impulses. It also carries the proprioceptive information from the facial and masticatory muscles. So next one is the spinal lemniscus. It was a part of the spinothalamic tract or the anterolateral system. So from the posterior horn of the spinal cord, it gives several fibers. The first one is the spinotectal fibers, superior colliculus. The spinotectal fibers from the spinal cord to the tectum, superior colliculus, so it is called as superior colliculus. The next one is the spino-periaqueductal fibers, spinal cord to the periaqueductal fibers, periaqueduct, the structure which presents around the aqueduct, cerebral aqueduct, the central gray matter. So the spino-periaqueductal fibers, spinothalamic fibers, ventroposterior nuclei and intralaminar nuclei. The spinothalamic fibers from the spinal cord to the thalamus. Here the spino-olivary nucleus from the spinal cord to the olive, and spino-reticular fibers from the spinal cord to the reticular formation. So these pathways is called as the spinal lemniscus within the brainstem. Next one is the lateral lemniscus. From the cochlear nuclei to the inferior colliculus, the tectum, there was a pathway called as the lateral lemniscus which carries the sound impulse. The cochlear nucleus also send the fibers to the thalamus, medial geniculate body of the thalamus, and the reticular formation of the brainstem. So next structure is the superior colliculus, which is the uppermost structure of the tectum. It receives the afferents from the retina and gives the efferent to the spinal cord, tectospinal tract. Tectum means nothing but the superior colliculus. Spinal tract means to the spinal cord. It controls the reflex movement of the eye and of the head and neck in response to the visual stimuli. So according to the visual stimuli, the reflex movements of the eye, the head and neck happens. Next one is the inferior colliculus, the inferior most part of the tectum, which has the afferent from the lateral lemniscus. The sound impulse is carried through the lateral lemniscus and give the efferent to the medial geniculate body of the thalamus. So this structure, superior and inferior colliculus, is more involved in the special sense. The superior colliculus is involved in the vision and the inferior colliculus is involved in the sound. Thank you.